I'm at McLaren Port Huron Physical Therapy speaking with physical therapist Curt Jevens regarding treatment options for patients with arthritis or patients that have had joint replacement surgery. Curt, thanks for joining us today.
Hi, how are you today?
Good. Could you give us an idea of what an arthritis patient would expect if they were to come in for an initial evaluation?
Well, typically the base evaluation with someone with arthritis is we're going to be looking at typically range of motion and strength. We'll also be looking at various aspects of the joint to make sure that there's not any other tissues that may be involved, such as ligament injury or tendon inflammation that may be part of the arthritis condition that they are coming in for.
What type of treatment goals do you typically set for an arthritis patient?
With arthritis, there's some restriction of movement typically and some weakness around the joint. So those are going to be our staples for looking at goals for patients to increase those either range of motion and strength. In addition, we're going to be looking at function of the individual to determine what they need to be doing in their daily life. So we will ask them about what their limitations are for their activities of daily living and then incorporate those into a goal setting.
So what type of physical therapy do you usually recommend for someone with arthritis?
With arthritis, we try to get the pain and inflammation under control initially, and then from that point, then we can start to address more the range of motion and strength and those functional activities that we were talking about.
Okay, so let's talk a little bit about a patient that has had the joint replacement surgery. What type of physical therapy goals do you set for them?
It's basically the same, but with a joint replacement, we have to have other things in consideration depending on what type of procedure they had done, depending on hip and knee. But again, we come back to range of motion, strength, function, addressing pain issues, inflammation issues, maybe scar tissue issues that might occur after the surgical procedure.
And with their recommended type of physical therapy, is it similar to arthritis patients also, or do they have something different that you recommend for them?
Specifically with hip patients, there's two different procedures that are being performed at this time. The traditional hip replacement has an approach that comes in that cuts muscle to access the joint for the physician, the surgeon, to perform the replacement surgery. With that particular procedure, there are certain hip precautions that we have to adhere to make sure that there's no complications or including dislocation of that joint. The other procedure that's now being performed at McLaren Port Huron is an anterior approach for a hip replacement, and with that there's no tissues that are being cut into, so the precautions that are typically adhered to from the previous standard procedure, they don't apply to those anterior approach hip replacements patients.
Curt, if someone watching the program today would like more information on physical therapy or treatment options, what could they do to get that information?
There is some information through our health access line, also through McLaren Port Huron.
Great, Curt, thanks for joining us today, and thanks for sharing all this great information.
You're welcome, sir.
This is Sarah Tate reporting for McLaren Port Huron, today's health program.